How could gene therapy cure sickle cell disease by targeting hemoglobin S? Imagine a world where a single genetic change could potentially eliminate the pain and complications caused by sickle cell disease. That's the promise of gene therapy, a cutting-edge approach that aims to fix the root cause of this condition. Sickle cell disease is caused by a mutation in the gene that produces hemoglobin. Specifically, hemoglobin S. Hemoglobin is the protein in red blood cells that carries oxygen throughout the body. When the gene for hemoglobin S is mutated, it causes the red blood cells to become rigid and shaped like a sickle or crescent. These misshapen cells can block blood flow, leading to pain, organ damage, and other serious health problems. Gene therapy works by targeting this faulty hemoglobin S gene directly. There are two main strategies used. The first is gene addition therapy. In this method, doctors take a patient's stem cells from the bone marrow, which are the cells that produce blood. These cells are then modified outside the body using harmless viruses to insert a healthy or specially designed hemoglobin gene. This gene either produces normal adult hemoglobin or an anti-sickling from that prevents the cells from sickling. After the modification, the stem cells are infused back into the patient's body, where they settle into the bone marrow and start producing healthy red blood cells. This process can help improve oxygen delivery and reduce symptoms like pain crises. The second approach is gene editing, which uses precise tools like CRISPR to directly change the patient's DNA. The goal here is to turn on the production of fetal hemoglobin, which is normally made during fetal development but stops after birth. Fetal hemoglobin does not sickle and can dilute the effects of hemoglobin S by editing specific genes that suppress fetal hemoglobin. Scientists can increase its levels in red blood cells. This reduces the number of sickled cells and alleviates many of the disease's symptoms. Both methods involve collecting the patient's stem cells, modifying them outside the body, and then reintroducing them after a conditioning treatment that prepares the bone marrow to accept the new cells. The hope is that these modified stem cells will produce healthy red blood cells for a long time, potentially offering a one-time treatment that cures the disease. Recent advances have led to FDA-approved therapies that use gene editing or gene addition techniques, showing promising results in clinical trials. Patients have experienced fewer pain crises, less organ damage, and an overall better quality of life. In summary, gene therapy targets hemoglobin S by either adding healthy genes or editing the genome to increase fetal hemoglobin production. This corrects the genetic defect that causes sickling and helps produce normal, functional red blood cells. While this approach is still relatively new and requires specialized medical centers, it holds great promise for transforming sickle cell disease from a lifelong challenge into a potentially curable condition. Anyone considering gene therapy should speak with healthcare professionals experienced in these treatments to understand the benefits, risks, and whether it's suitable for their individual health needs.